Thank you, doctor, for being on this show. You start your blogs with a defining single sentence which gives the reader a gist of what's going to come. How much time does it take for you to get the single line compared to the rest of the blog script?
I don't really, to be honest, think about it so much. It's constantly running on in my mind when I'm thinking about what I'm going to write next. But when I sit to write, sometimes it can take really long, and sometimes it's either something a patient has said, or it's something that I've observed, or it's an operative nuance or a problem that we want to address. When any of those things, actually no one's ever really pointed this out to me before, but I think a first line is an important line in any piece of writing, because it really gets someone to read it, or you've lost the reader in the first couple of lines. So I think maybe I'm going to pay a little more attention to it now.
I was reading somewhere it said writers spend about 70% of the time just for that title than the rest of the script. I was going through your TED talk, Minimalism of Maximality, wherein you have sprinkled a liberal dose of humor. Do you endeavor to inject humor in the operating theatre to lighten the mood?
Yeah, I think humor is extremely essential in any walk of life. In any difficult situation, you need someone to ease it up, and I think the kind of patients we treat provide a small bit of humor. In the operation theatre, you have to be innovative and figure out your own ways to be merry.
Thank you. There is a school of thought which proclaims diseases can be cured by positive affirmations.
Yes.
Your take on this theory?
I'm very open to it. If you really believe in it, I feel that you can go a great deal in healing yourself in ways that are unimaginable. So your belief system needs to be 100%. And if you have that kind of unflinching faith that you will be okay, more often than not you will be.
It's quite comforting to hear. Specialized medical treatment is beyond the reach of the poorer sections of society. Do you think Rotary, in conjunction with you, can do something?
Yes, actually, the Rotary, we've been closely talking to the Rotary to fund some operations, especially in the realm of epilepsy surgery, where a large population requires an operation when they are refractory to medication, and surgery can return their quality of life to a level that is unthinkable and unimaginable. And we are in the process of wondering if Rotary can help us fine-tune our epilepsy program at our hospital and see how we. A lot of people tend to fund pediatric surgeries, cardiac surgeries, and those are things that they believe are quote unquote at the heart of the matter. But to restore a youthful person, a young adult, back to normalcy, it's the greatest service you can do to society.
Thank you for your time. Anila would like to have a word with you.
Doctor, one question, that there is a myth that after pandemic or COVID, people are getting more brain stroke or something of that sort. Is it?
COVID is a vasculopathy. It's a disease where it thickens the blood. So, like you get reactions to thickening of the blood anywhere in the body, the same thing happens with the brain. So it's true that patients did sustain a lot more strokes than we saw in the pre-COVID era.
Thank you for clearing this myth. Otherwise, everybody was just talking. It's like a Chinese whisper, and then it goes to, and of course, it is directly connected with. And when your brain surgery is when you do, and follow up. So, what is the one mantra you would say that they should bear in mind after the operation?
Brain surgery. I think both brain and spine surgery, you just have to keep yourself active. people, usually tend to believe that, oh, you've had surgery, you need to rest for 3 months, 6 months, take it easy. No, most of our patients are out of hospital within a couple of days of surgery, and they're told to resume whatever they were doing before the operation. And I think just remaining active both physically and mentally is the key to any kind of well-being.
I think after the surgery, seeing this handsome doctor, everything, brains will start functioning over time and very well. Thank you, doctor. Thank you so much.